My name is Brian Heer, H-E-E-R. I am the owner of a company called Stretch Zone. A lot of you I've seen before. Thanks for coming out again. Stretch Zone is a company that does practitioner-assisted stretching. So that means we do all the work and you just lay there and enjoy it. It's a terrible thing we ask you to do, you know. But I'm going to go at the end of this over a bunch of stuff you can do at home, because there are some stretches you can do on your own that are very effective and safe ways to do those. By a show of hands, and please be a little interactive for the first few minutes, how many of you guys have lived in Brunswick Forest? Well, first off, how many of you live in Brunswick Forest? Nobody snuck in from the general public, which is fine. How many of you guys have lived in Brunswick for more than a year? This is just less, a little less. A month? Welcome. They do a lot of good stuff like this out here, where you can come and learn, and you've got a beautiful environment to be healthy in. Certainly, this is one of the best communities out there for being active. And I do talks at a lot of places that aren't quite as nice as Brunswick Forest. So be thankful that you got a good place to build your health from. But I wanted to talk today again about lower back and hip, because it's quite honestly the number one thing that we see, and it's really the number one thing that any person in healthcare sees. You'll be surprised when you see some statistics about how common lower back pain really is. I'm a retired chiropractor, so I spent the bulk of my life dealing with the spine. And back pain was a very big reason why people would come to see me. But you never want to get to a place in your life where you accept that pain is normal. There's a lot of people that think, well, I'm a certain age, I should be in pain. Or I deserve to be in pain, I've lived this long. Or I've lived through all the injuries that probably should have killed me. I'll take what I can get. But there's really no time in your life that you can't regain flexibility. Now, degeneration and arthritis and things that are damage-based, you really can't get rid of, but you can certainly do a lot to mitigate them getting worse. And there's really no reason that even with arthritis or disc degeneration that you have to have pain. Plenty of people have degeneration and have no pain. So this statistic, I hope, takes people back. 84% of our country has chronic lower back pain. Not just episodic back pain that comes and goes once in a great while. Like, they struggle. That's more than cancer and heart disease combined. It's a lot of people. If you think of there's 300 and some million Americans, right? I mean, 84% is a lot. And honestly, what's sad is that 84% is mostly adults. But there are children that struggle with chronic back pain. Anybody here have grandkids? You ever see their face anymore, or you just see the top of their head? Because this kind of little thing right here, these devices and phones and things have destroyed our postures at any age. And I would beg to differ. If somebody says they don't, that's great. But most people probably use a phone every day. Not just for things to get done, but for entertainment purposes. And they spend a lot of time doing very much that same posture. Think about your head for a minute. Like, your head weighs 12 pounds on average. So that's like a bowling ball. That's a pretty heavy head. That's only 12 pounds when it's directly above your spine. But for every inch your head goes forward, it's another 10 pounds of pressure that it puts on your spine. So if somebody's 6 inches out in front of them, they got 60 to 72 pounds that they're trying to hold up all day, And some of us have bigger heads than others. And some of us really don't have the greatest posture on earth. So one thing I love to do when I start this talk, because it's really helpful, is I invite everybody right now to sit up as straight in your chair as you would if you were going to have a picture taken of you for your family photo album. And just think for a minute, how much did you really have to move to get there? It probably wasn't, it's probably not your most comfortable position right now. But if you sat in that position for a few minutes, you go, yeah, that does feel better. I feel like I'm stacked more appropriately, right? So we're all guilty of it. It's not a fault of anybody. We have a society of people and we're in a world that we live in where this shape has become the normal shape for people. But a chair is a man-made invention. It's not natural. It's certainly not good for us. And it's very rare that anybody is sitting in a chair like this, right? Looks forced. Almost looks fake, doesn't it? So we love to sit. This feels good, right? And we do it a lot, not just in our chairs like what we're sitting in right now, but we sit in our car. You sit. Think about how many times you sat today. It's 2 o'clock, not 3. You sat on the toilet at some point. You sat at your coffee table. You probably sat in your car. You probably sat on your couch in front of your computer. And now you're sitting right now. So, we got to understand that sitting is a artificial posture for humans. There are no other animals in the entire animal kingdom that sit down in a chair, unless we've trained them to do that for circus shows and things like that. You've never in your life walked out in the woods and saw a deer with their legs crossed, hanging out on their phone. Those are just things that we do, and that's why we have 84% of lower back problems. I don't think the deer and the antelope and the rabbits have a lot of back problems. So I like to touch on, really there's 6 things that can be the cause for contributor to back pain, or hip pain for that matter. And I want to say this, they really are kind of interchangeable. Like most of the time the low back and the hip go in tangent with each other, or one begets the other. Like maybe you hurt your right hip and then a couple months later your back is kind of compensating and hurting in other places to try to make up for it. By show of hands, how many people just have lower back pain and don't have any problems with their hip? Anybody have just hip pain and no problems with their back? Everybody else is both? Or just...
I have a neck pain. I missed your other...
Listen, it's okay. I had a guy come in today from the talk I did last time on neck pain, and his only problem was low back pain. So I said, I don't care how I got to get you in my office, whatever it takes. And he wanted to come here today, but he had something come up. But spinal pain, I'll just call it that. How about that? The entirety of our upper body and lower body together. Here's the thing. There's a time and a place for drugs and surgery. There's a time and a place for physical therapy. There's a time and a place for massage, chiropractic, yoga. But at the end of the day, all of those approaches in terms of what makes somebody happier is that they feel better, right? I mean, what do you think feels better? It's their muscles. It's always your muscles. Your nerves can be involved, but they still affect the tone and tightness of a muscle. Your bones and joints can be degenerated, or you can have disc problems, but at the end of the day, what hurts is your muscles. So there's a time and a place for that stuff. And what am I trying to say? Humbling is that even when people have surgery, they still have a need to be flexible. If anything, they have a need to be even more flexible because now they have artificial parts that really don't belong in there. Anybody have surgery? I know I've seen a couple people's scars, but anybody have back surgery, spinal surgery? Care to share? Young people have it. So understand that there's a time and a place for it. Thank God there's a great surgeon when we need one. If I get hit by a Mack truck walking across the parking lot, please do not bring me to stretch zone. Take me to the hospital. Let a surgeon do their job and fix me. But, there's so much more to your health than just the lack of symptoms. And I think that's what worries me about most people is they're just so involved in everything in their day to try to find relief that they're not thinking about how could they prevent problems, how could they improve themselves, or how could they prevent a worsening of their current issues. So I like to start with stuff that usually wants to put people to sleep, so I'll go through this really quick, but the names of these muscles are really important because they help. These are the muscles that are mostly involved with back pain. There's only 5. Now there are groups of muscles, so I shouldn't say there's only 5, you know, like the erector spinae muscles. Break that word down for a minute. What does erect mean?
Straight.
Upright is actually a better definition of it, but yeah. When you erect a building, right, you're building it up. And the spinae just means spine. So there are muscles that are on the sides of the vertebrae that go all the way at different levels, at every single level on both sides. So you have pairs of those muscles all the way from the bottom of your skull all the way down to your tailbone. But when they engage, they pull us back erect. And so if we sit and fold over all the time, or if our posture isn't just perfect, those muscles are being challenged all the time, and they're trying to pull your head and your upper back over top of your body. No wonder people have lower back pain. Nobody has lower front pain. On that statement, I challenge you. If you have lower front pain, raise your hand. There's always one in the crowd that has to try this. If we did this all day, then we'd probably have lower front pain. Because these muscles would stay engaged all the time trying to pull us back. And then everybody would be running around with 6-packs and really good low back with no pain. You know what I mean? But because we go the other direction, everything's pulling, and that's when we develop symptoms. Same thing with the latissimus dorsi. Those muscles, I apologize if I'm blocking your view. The latissimus muscles are just these muscles on the lateral part of our spine that when they're engaged, laterally flex the dorsum. Dorsal just means posterior, like a fin on a dolphin or a shark, right? They have a dorsal fin. So your dorsum is essentially this part of your spine. But when they engage on one side, they laterally flex the dorsum one way. So those muscles can be very uncomfortable, and those are usually a cause of lower back pain too. The multifidus muscles are, well, multi just means multiple, right? So they have multiple functions. They're not just for extension, they're not just for lateral flexion, they do all 3 things. You can have rotation involved with multifidus. You can have lateral flexion, you can have flexion and extension, mostly extension. And then the QL, most people in the gym world know what a QL muscle is, but if you've never been in a gym before, that's okay too. You probably felt this muscle before, because it's right here. It's a square-shaped muscle. It's right across the lumbar spine, that's why it's called the quadratus lumborum. The last one is called your psoas muscle, or the iliopsoas muscle. And that's one of your primary hip flexors, but it goes up through your groin into your spine and attaches to your vertebrae and your discs right in here and goes straight down that way. So when it engages, it pulls that leg up, or if it's tight, it pulls your posture this way. Anybody seen their great-grandmother walk around like that when they were younger? Mm-hmm. Shortening every year. So as you grew and she shrunk, at some point you were taller than her. Everybody's destined to have that happen to them if they don't work on their flexibility. So it kind of is important to know, like, even if you feel great, like there's plenty of times I do these and there's somebody here that's like, I don't have anything wrong at all, I just wanted to learn. I'm like, perfect. You're the kind of person we should be seeing, because if you're already in pain, you're probably already damaged. It's a lot easier to keep somebody flexible than it is to restore flexibility that they've lost. Makes sense, right? And so the hips, same thing. You know, again, this could be a sleepy moment. I promise it'll get more exciting in a minute. But there's a lot of muscles in the lower extremity. And quite honestly, these are the big ones. Everybody here has heard of the glutes, I'm sure, the gluteus muscles. They are not a seat. They're not a muscle for sitting on, but we do. And that's why the glutes tend to become tight, and that's why they tend to become weak, because we don't really use them for much. They're meant to extend our hip, but it's pretty rare that anybody's going that way with their leg, right? We might go this way a lot if we're kicking our husband in the butt to do something, but we're not going that way. So I encourage you, if you're going to kick it, go that way next time. The piriformis sits right underneath your glutes. So your glutes right here, and then under it is a narrow muscle called the piriformis. That is your primary external rotator of your hip that takes your leg that way. And the piriformis you'll see, I'll go over that in a little more detail, is the big one for sciatica. Anybody ever had sciatica? Supposedly the worst pain outside of childbirth.
Don't know that one, but know the other one.
I always joked that whoever said it was worse than childbirth was probably a man, because I'm sure that no woman said that, but what do I know? I've never had a baby either. Your iliotibial band, we just call it the IT band to make it easier to understand, but it comes from the top of your ilium, past your hip, down the side of your leg, and past your knee joint to attach to the tibia, which is that outer bone of your lower leg. And then there's a muscle that attaches to that that's up higher called your tensor fascia lata. Again, big words, don't need to really know the words, you just need to know what they do. Because here's part of the problem. If we don't know we have a muscle that needs to be stretched, are we gonna stretch it?
No.
And if we don't even know where it is, how do we know if we're stretching it? So that's what I want you to leave here today with, is some knowledge of like, okay, I get the idea of what, there's muscles on the outside, muscles on the inside, muscles in the front, muscles in the back. Just, think what they're trying to do. They're either trying to make you go forward, sideways, or rotate. It's really the only three motions that exist. That's why it makes it easy to stretch them. Because if you know which direction, challenges a muscle, you know which direction to go to try to make it more flexible. The hip flexors, most people have heard those words, don't know what they are, so I'll show you all those in just a minute. And then the hip adductors are the ones that take your legs that way, across your body. Any of you guys pickleball or tennis players, golfers, any sport? Adductors are really involved with people that do motions that are going this way, because they're just trying to keep you from going that way, right? They try to prevent you from doing a split. How about that? That's a good way to understand what they do. And then hamstrings. Raise your hand if you've ever heard of the word hamstrings. Right. You know why? It's really easy to understand. Hamstring was the only word that our coaches could probably pronounce. And they're the one thing we think of when we think of stretching, right? Like if somebody says, let's do a stretching class or go stretch before we do a game, the first thing you're thinking is like, oh, I'm gonna bend down and stretch those muscles in the back of my leg. Hamstrings have a lot of functions. One of them is keep you from falling forward. So if you think you got the erector spinae in the upper body trying to pull your spine upright, but then you got your hamstrings trying to keep everything from here upright. So everything in the back of you is where you're gonna see the majority of your problems. Very rare to see problems with the front musculature. And I'll tell you one of the reasons why, this should make sense, think about it. If I take a muscle that's supposed to be straight and flat and sit like this with it being at a 90-degree angle, it's gonna shorten. Those muscles in the front are gonna shorten and become tighter. And that's what makes it hard to get up sometimes. You see people doing this when they're getting in and out of cars and out of the restaurant, right? Okay, here we go. It doesn't take long. You may even see it just in the time you're gonna sit here. You might get up, and if I see you doing it, I'm gonna point at you, and I'll be like, come see me. But know that that's part of the reason, is if we compress our postures, our body's gonna follow suit. It's gonna go, hey, this is where she wants to be. I'm gonna make everything tighten up in that position. And then the quadriceps are the front muscles that we were just talking about. If they're really tight through here, or your hip flexors, they're gonna create that posture. You want to avoid that posture? It just doesn't look good, right? Even if it had nothing to do with health. If it was just a vanity issue. Does somebody look more confident and poised when they have posture that's good? Or do they look, does that look attractive? No, not at all. Don't forget about the calves. So the calves sit below the leg, in the lower leg, below the thigh. And your calves are actually two separate muscles. They're very important. Doesn't this look like an upside down heart? Follow me on that? Not an anatomical heart, like the cartoon heart. It's called the second heart because it does pump blood from the extremities back up to the heart to get it oxygenated. So it takes the deoxygenated blood that's been pumped down, sends it back up to the heart to get oxygenated. If those muscles are super tight, it does not do that. one of the reasons people get swelling and edema in their ankles. And you may yourself have that. And the soleus is underneath of the Achilles tendon here. It goes all the way underneath this. This is just on top of it, the Achilles tendon. And when the soleus is not right, you got a lot of problems with your foot, especially things like plantar fasciitis. I love to send this home with you, so if you guys have given me your email, I'll send you a copy of this. I'm not going to drown you with boring information, but it's important to understand that there are different types of muscle tissue. That's why stretching needs to be done differently for certain areas of your body. The holds, the length of time you stretch something is different for a postural muscle than it is for some of your more voluntary muscles. And postural muscles are all your spinal muscles. And they fatigue very, very slowly. That's why you can sit for a long period of time before you start feeling back pain. By contrast, the phasic muscles, phasic just means to move between phases. Those are your voluntary muscles, and those are the ones that, like if you were to lift up a barbell and pump your bicep, you could only do it for a number of seconds or maybe a minute before you're going to fatigue, and it's going to be like, whew, I'm tired of lifting that weight 30 times in a row. So those need a different type of stretch completely from a spinal muscle. Is that the first time anybody's really heard that? A lot of people think you just stretch till you feel like it's pulling and then you let go, right? So there's some smart ways to stretch. There's some, don't take us wrong way. You could stretch however you want and it's still better than doing nothing. It's like brushing your teeth. It's better to do it once a year than not at all, but there's another way to do it that's the right way to do it, and the same thing with stretching. There's really good ways to do it, and there's ones that don't take very long to do. If you're stretching a muscle properly, it doesn't take long at all. But this is actually really important to understand the difference between what we do as a practitioner-assisted stretch compared to what somebody can do on their own. And I like to give, here's a better way of saying this. So everybody's got a table in front of them. Put your hand flat on the table in front of you. And try to just take your index finger and lift it as far up off the table as you can. And you'll go, wow, I can't go any farther than that, right? And notice that all of you have a different varying degree. Some are going high, some are not going so far at all. But if you took your other finger and grab onto that and pull up, you can see how much more of a range of motion still exists there that you can't get to on your own. Does that make sense? So that's your passive range of motion. Don't sprain your finger. But your active range of motion is what you can get to on your own. Passive is what you can accomplish with the help of someone else. And that's really why a company like ours exists, because if we're not taking people into their passive range of motion, they're never going to improve their range of motion. Albeit it's good to stretch on your own. I would always encourage you to stretch on your own, but you can only go so far. And you can only go as far as your tightest muscle in an area. Does that all make sense? So I just basically talked about that. It's called your para-physiologic range of motion. You have your physiologic, which is what you can actively do. Para just means beyond, like paranormal. This is somebody getting stretched in the office. And again, I bring the table out for a reason, because it probably scares most people to see that table if they don't know what we do. Like last time somebody brought out straps for me, it wasn't good. Nobody's gonna wheel you away to the asylum, I promise. But the straps are super important because without them, there are physiologic ranges of motion we cannot get into, even if we're the ones doing the stretch for you. Does that make sense? And the nice thing about us is we do it all. Like you literally just show up and lay down and that's all it takes. It's one of the coolest things in this world that you can do something good for your health where you don't really have to be that involved. It's one of the only things you can do that with. There's no treadmill that I can pay somebody to run on that makes me lose weight, right? Can't pay some bodybuilder to go work out and my muscles get bigger. But when it comes to flexibility, you can get it back without really doing much on your own at all. So what I'm gonna do is, I'm gonna have Mackenzie come on over here, and I'm gonna ask Miss Deb if she wants to just be a quick little volunteer, socks or not. So Deb's already climbed in our studios, so that's the only reason I'm letting her do this, because I know she's clear for takeoff. If you'll let her do that. So I'm just gonna show you what a warm-up looks like, because warming up is vital to stretching. Stretching itself is not a warm-up. People think all the time that, oh, I warmed up. I'm ready to play a game, you know. You really want to get blood flow into a muscle. We encourage people to walk a little before they come into the studio because that helps get the blood flowing pretty good. But if they won't, which is a lot of people, most people just show up, come in cold, we try to get a little bit of blood flowing into the stuff we're going to work on prior to ever putting a stretch on someone. Looks like, because warming up is vital to stretching. Stretching itself is not a warm-up. People think all the time that, oh, I warmed up. I'm ready to play a game, you know. You really want to get blood flow into a muscle. We encourage people to walk a little before they come into the studio because that helps get the blood flowing pretty good. But if they won't, which is a lot of people, most people just show up, come in cold, we try to get a little bit of blood flowing into the stuff we're going to work on prior to ever putting a stretch on someone. And there's a lot of different ones. So she's just going to go through a series of them to get Deb warmed up. But one of the best things you can do, one of the first things we do, is a stretch called spinal decompression. Anybody have compressed discs and know about it? Seen them on an x-ray where they're thinner than the other ones, or they say you have a degenerative disc or degenerative joint disease? So I like using this ball as an analogy. Here's another good question. How many of you guys wake up and it takes 20 minutes to start moving before you feel really good? Or let me say, you wake up a little stiffer than you go to bed.
Wake up sniffer, yeah.
So think of the rubber band in this ball. If this ball was the discs between two vertebrae, when we are going through our day, the disc is being squished a little bit. And it eventually gets to the point where it's about as deflated as it can get for that day. But now the muscles that are around it are a little looser. So as we compress, muscles loosen, not because the muscles are more flexible, just because the space that they're occupying is less. But then we lay down at night and gravity's not on our joint and those discs start to re-imbibe nutrition because they don't have any gravity pushing down on them constantly. Now those muscles get tight while we're asleep. So when we first wake up again and start walking, now we have tight muscles because the disc did heal while we were asleep at night. It's a really good thing that it does that. We should heal while we're in bed, but it's honestly the only time of the day that we really do heal. Do you mind doing the decompression? We don't heal during the day when we're weight bearing. Does that make sense? Like, just like your teeth aren't getting cleaner as the day goes on as you eat, they get clean when you brush your teeth, right? So the same thing, you know, this stretch just, most people ask us if we can do it for the full half hour. And we're like, well, we could, but we got other things we should probably work on. And then this is a really important concept. So if you're going to stretch on your own, or you're going to come to us, whatever way you decide to go, it's important that you understand the intensity scale of 3, 5, and 7, especially if you're thinking on a scale of 1 to 10, where 10 is like, whoa, buddy, that's way too much, stop right now. And 1 is like, I don't know, I don't really feel anything at all. When you first do a stretch, you should always take that muscle to just where you feel anything. And when you feel that little bit of a stretch, you have to stop right there for a second and let your body acclimatize to it and say, is this Joe stepping off the curb the wrong way and pulling a tight muscle? Or is this Mackenzie pulling this muscle in a direction to help make it more flexible? Because your brain doesn't know the difference. She's a nice person, but your brain does not care. It just knows this muscle is being moved in a way that I'm not used to moving it. So the 3 is just a nice light stretch. A 5, you know, we go from that 3 and then move it a little further to go to a 5. In fact, if you're okay with me doing this, I'm just going to show a couple things. So we have these straps and belts that are very important. I'll make sure I explain them a little bit more as we go. This first one is called a championship belt, and it just helps keep her centered and not feeling like she's going to fall off my table. kind of important, right?
Yeah.
It also really allows her to relax, because if she can't relax and she fights me while I'm stretching her, then we're kind of countering what we're trying to accomplish. So I'm just going to demonstrate on her iliotibial band, the IT band we talked about earlier, right? So that runs from here all the way to here. So if I was just to take her over her other leg and bring her to there, she'll tell me when it starts to first feel like she's stretching. So a 3 or a thumbs up is a completely fine way to communicate. Saying, ah, is not. So then we would go to a 5, and she's in control. She's going to tell us when that's at a moderate intensity. Now, I'm putting her on the spot. She doesn't have short stretches today, later today. How long has it been since you've been in? About a week? 2 weeks? It's not
I was out of town.
So a 7 would be a good deep stretch. So we're going to take that and go into it as far as she can handle it. And she'll tell us when it gets there. So did you see like the concept that you went from a little stretch, a little further, a good deep stretch? If you jump right into a deep stretch, you're going to hurt the muscle. And your brain is going to remember it, so that the next time you try to stretch, it's going to say, nah, I fell for that one time before. I'm not doing it again. So that's really the smarts when you're stretching yourself. If you're going to do your own stretching, just think, okay, if I'm just going to go down and touch my toes, okay, when I first start feeling it, that's my 3. Who cares what anybody around you thinks you look like, right? But then once that's well accepted, then you go, now I'm going to go to a 5. And hold that for a few seconds. And then go for a 7. If you do it in that order, I promise you, you'll never hurt yourself, and you'll actually see your flexibility increase. So we talked a little bit about the patented strapping system. It's very important for a lot of reasons. One of which, it kind of acts like a second set of hands for the practitioner. It's like somebody holding her down so that this stuff can all be isolated without her compensating as we move her through the series of stretches. Does that make sense? And it's very, very important for isolation. We have to isolate the muscle we're working on, or else we're just stretching everything around it. Most of you guys, when you stretch yourselves, you probably do the ones that feel good and don't do the ones you don't like. But the ones you don't like are probably the ones you need, more so than the ones that feel good. Any of you guys stretch on a regular basis, like daily, a couple times a week? Raise your hand if you think that you probably should. It's everybody. So understand, we all know we should do it, but we're guilty of doing it a lot more often when we feel bad than not doing it enough when we feel good. Make it part of your life, just like brushing your teeth. If you went, hey, every day I'm going to stretch for 30 seconds, you're going to have to do it for very long. Just do one muscle. Do something. If you did it every day and you switch those muscles up every day throughout the week, you could get to really a large number of your muscles in a month, which would be a far cry better than what most people do, which is none. So again, we talked about the iliotibial band. It's very important to understand that it's not a muscle at all. It's actually a band of connective tissue. But it's the insertion point for these glutes that attach to it, the tensor fascia lata that attaches to it, and the lateral quadricep muscle that attaches to it. And everything we do in the studio starts with the most superficial muscles or structures closest to the skin, loosens that up before we try to go to the muscles that are underneath of it or deeper to it. That's why you want to do your stretches in the proper series. All of our stretches have protocols to them. So if we're working on like the lower hip and low back, we have a series in order that we go through, because one unlocks the other. Most people, when they stretch, do what they were told to do by a doctor or a physical therapist for their symptom. They're not going in order, they're going directly to the painful muscle. And it's not really the right way to do it. It just isn't. So you saw that stretch, the IT band stretch. The tensor fascia lata is part of the IT band. See how it connects at the top? It's all band, and then this becomes muscular. It's one of your hip flexors, but it's also one of your abductors of your hip. So getting up out of a car. About like you trying to get out of your car if you're down low and you're trying to get up to get out of your door. Or if you're sitting at a booth at a restaurant and you're trying to get out of that booth, right? You gotta kind of like do one of those numbers. Anybody when you're laying on your side at night feel like dull, achy, gnawing kind of pain? That's usually the tensor fasciae lata. And again, it's a muscle that I guarantee you very few of you have ever heard of. If you have, you didn't know where it was. And you probably didn't know how to stretch it. That's done very similarly. Do you mind showing the TFL since we already did the IT band? Now, one thing I'm going to say about her being out here is normally, thank God she's coming in for a real session later on today. We don't want to just work on one side of the body because then she starts walking around in circles when she gets outside. You need to work on both sides, regardless of whether your pain is only on one side or not. Your brain will only allow you to improve as much as your good side. Does that make sense? So you really want to work on improving your good side so that your bad side has something better to even catch up to in the first place. So very similar to that positioning that we did with the last one, but this one's getting a little bit more on the outside of the hip and not down here. And that's just a better picture if you can't see it where you're seated. Lower back and hip pain are almost always going to be from these muscles we're talking about. All right, anybody here to the glutes, right? We got the butt. Tight glutes always cause back pain. It's really important to understand that because we all do the same thing where we sit on. And for a second, I just want you to think about your posture again and think about how much you've devolved from that upright posture that you sat in when we first started. You don't have to move, but just think, dang, it would take a lot to get back to that position right now. And I've only been talking for 30, 40 minutes. So the glutes I won't have you show, but very similar to the position she was just in, but now pulling this way. Try to stretch the backside of the buttock. Piriformis sits right underneath the glute. So the glute would normally sit right here and you'd only be able to see it because it's a big bulky muscle on the outside. But right underneath of it is this piriformis muscle that's attached to the hip and is what's allowing us to take our hip out and back. But when that muscle tightens up, it goes right over top of the biggest nerve in our entire body, the sciatic nerve. And so if it compresses on that, you will have sciatica. And like I said, that's one you want to avoid. Sciatica is a miserable, miserable condition. All right, so we talked about those erector spinae. Do you mind setting her up for, trying to think how would be easiest for them to see. Let's switch it up. So these are stretches that, and again, I was a chiropractor a long time. These are muscles I couldn't stretch myself, and I knew what I was doing. They really do require some help. And once she's getting done setting that up, we'll show how that works. Unfortunately, these are muscles you can't stretch by yourself. You could try. It's not a bad idea to try to mimic the position, but in order to properly relax, you'd have to be strapped in. You'd have to, do it a certain way. But how many people here are guilty of those four things? Or one or two or three of them? I know I am. The big one, the bottom one's really important. People think, what does my head have to do with my back hurting? But if you're in a bed all night, you can go ahead and do stretch. If you're in a bed all night long and your head is rolled forward with a big pillow behind you, you're essentially creating the same posture that we're doing right now when you're standing up, right? And I know some of you do it because you're married, and if you don't, you'll snore and then you'll get elbowed in the middle of the night. I get it. But think about if you're only comfortable with a pillow or two or three behind you, what does that say about your posture? So can you see how if she didn't have the straps on right now, it would be a very precarious position that she might feel like she's gonna fall? How do you feel on that, Miss Deb?
I feel pretty good.
Yeah. And that's just taking her spine and rotating it enough so that we can stretch all those muscles. That one feels pretty darn amazing. And then the lats, we won't show those out here, but the lats, a great tie-in, because the guy that came in this morning that I was telling you about, his pain is in his lower back, rib area, and his shoulder hurts all the time. And I was like, buddy, he's like, that's your, he had come to the talk, so he knew. He's like, I think it's my lats. And I'm like, you think so? It's like every single thing that you could have that this guy suffers from. And lo and behold, it was. His lats were terrible. But your lats are not just a spinal muscle, they attach to your arm, and they pull your arm down and inward. So they're actually a shoulder muscle as much as they're also a spine muscle. And that one just looks a little different. It's a lot easier for you to see it from the picture than to do it right here where you can't really see what Mackenzie's doing. But it's just opening up the spacing between here all the way up to the shoulder. Essentially taking people here. Anybody have trouble getting their arms up over their head? A lot of times it's your lats. They're just so tight that they're like, that's as far as I can go. I can't go any farther. And then the calves. Go ahead and just do, yeah, you can take that off and just do that one. So calves are really easy to overlook because most people don't have calf pain. But hamstring tightness, lower back pain, plantar fasciitis, loss of your foot arch, neuropathy in your feet, largely is pressure or tension on the soleus muscle or the calf, or the gastroc. And those stretches feel pretty good. Those two you can kind of do on your own. I don't think you can do soleus on your own, but you can definitely stretch your big bulky calf muscle if you just put it up on a curb and lean forward, right? Or if you put it in a doorway on a stair and just try to take your foot and essentially do that with your foot. That's another one that most people stretch on their own because they think of hamstrings, calves, and shoulders. If you see people at a marathon, we go out to every marathon there is here, and it cracks me up how many of the marathon runners don't take advantage of the fact that we're there giving a free stretch doing it the right way, but they're on the ground doing it in the parking lot the wrong way. And I'm like, come on, you're killing me. Because athletes tend to think they've already got it figured out. Athletes need this just as much as anybody else. They may not have the symptoms that a lot of the other people that we see have, but they really need to be flexible just like any other human being. So that's a lot of the stuff that really does tend to come from a calf problem. Even your knee problems, your back, your hips can stem from tight calves. Anybody have heel pain or foot pain? Fasciitis? None of you. It's pretty rare that we don't have that in the room. Most people that have back problems develop foot problems, or vice versa. You hurt your foot when you're young, you walk crooked for a while because you hurt that foot, and now you put more weight on one hip, and now you start changing your spine, and before you know it, it kind of works its way up. Has anybody ever seen a train wreck on the news? Not you, Deb. We're not talking about, you're not a train wreck. Notice that only one car of the train went off the track. But all the other ones have to bunch up on each other because they're connected. That's the kinetic chain of events that happens from the foot up. You can have a perfectly good back, hurt your knee playing a sport like football or basketball when you're a kid, and walk differently for a number of years and create a hip problem on the other side because now you're not putting all the weight on the bad knee, you're putting it on the good hip, but then that wears out. And that's not good, so you start putting pressure into your spine. We really are a kinetic chain of events that needs to start with the feet. So the hamstrings, there's 3 muscles that actually make up your hamstring. Most people know of one. They say, oh, I'm gonna bend down, stretch my hamstrings, right? But you have an outer hamstring called the bicep femoris, and then 2 inner hamstrings. And it's usually one of those 3, if not 2 of those 3, that are the limiter for the rest of them. There's, you're only gonna go as far as your tightest muscle. Does that make sense? So if one of them's super tight and the rest of them are like perfect, you're still only gonna go as far as that super tight muscle lets you go. So we break it down and do each individually, and I think it's just important to see it. If she were strapped in here, I would make it make more sense. But so outer hamstring, and for yourselves, think of it this way. If your toe is straight up, that's going down the middle of your hamstring. If you turn your toe outward and your hips, if you're going that way, now you're going to stretch the outer hamstring. If you take your toe inward, you're going to stretch your inner hamstring. So it's really easy to remember. Outer goes for outer hamstring, inner goes for inner hamstring. The angle is the only thing that's different. Like if you're trying to do outer hamstring, you want to take your leg towards the opposite shoulder. If you're going to do inner hamstring, you want to take your leg towards your same side shoulder. Make sense? Good job, Deb. But that's, I think if you walk out of here with any common, what am I trying to say? Big idea, maybe is the right word, is that you're only going to be as tight or, as good or as flexible as your tightest muscles. You can have perfect muscles everywhere and have one tight muscle that's going to ruin your day. That's the reality. Very few people have every muscle terrible. But just as rare is that everybody has all muscles flexible. Because we all do different things. We do them repeatedly. How many of you guys cross your legs the same way every time you cross your legs? How many of you carry a purse on the same shoulder every time you carry a purse? How many of you sleep on the same side in the bed every time you sleep? There's a lot that happens that's one-sided, right? Hip flexors I'm not going to show out here, but they're all in the front. So this is a person facing this way. See how all those muscles are on the front part of the joint? So again, when we sit too long, they shorten. When we lean forward too long, they shorten. But then conversely, if they're already short, when we stand up, we want to lean forward because it feels better, which makes the problem even worse. And then at some point, we end up going more and more and more into flexion. Those are done a very specific way in the studio where this wedge would be at the end of the table. I'm not going to get her in that position right now. And then the hip would be allowed to drop off the side, keeping the knee at a 90-degree angle and not having to do what most people do for their hip flexors or their quadriceps, which is pinch that knee like that. If you're an athlete of any sort, you've already learned this one. It's a terrible way to stretch your body. It's ripe with knee injury, and especially if you've had a knee replacement or if you've had any kind of knee surgery, really important to stay away from. This way is very safe to do. Again, I could go into all these individually, but I'm going to give y'all a copy of this at home. There's other ways to stretch those muscles when you're on your side. But again, all of them require some level of strapping for safety, for isolation, and for being specific. I only throw this one in here. We don't even stretch this one in the office very often, but it's just interesting. The sartorius is known as the tailor's muscle, because back in the day when people actually had their clothes tailored, instead of just buying a new one, that's what we do today. They would sit like this to work on what they were selling or what they were tailoring. And that muscle is the one that comes across, and it's when you engage it, it takes your leg in that direction. You have to have a good sartorius muscle to get in that position. But it is one of the primary hip flexors, along with the ones we were just showing on those last few. All of them are on the end of that wedge. And then, of course, we're talking about the back, right? So there's some stretches that are very specific to our lumbar spine. Go back one. So can you just demonstrate that one? We'll take the belt off because with this one, we're trying to create motion, not limit motion. I would go that way just so you're not blocking there. If you try this one on your own, please don't do it on a table without straps by yourself and fall off. I take no responsibility if you get hurt at home on your own. This is a feel-good stretch. There are no numbers with this. Remember, we had the 3, 5s, and 7s. With this one, it's a postural muscle. Remember, we said postural muscles need longer holds than our voluntary muscles. So this one is just a comfortable stretch, trying to open up those lumbar discs. Mackenzie has her pin down at the shoulder, so she will not fall. You can kind of mimic this position on your own. You could do it in your bed, you could do it on your floor. I'd suggest doing it on the floor. You have much less distance to fall if you lose your balance. But part of the problem with doing stretches on the floor is that it's not hard to get down, but it's sometimes hard to get up. And all of our protocols at Stretch Zone are essentially based off of a lot of different types of healthcare, but one of them is Thai yoga and Thai massage. You know, in Thailand, they would have you lay on the beach and stretch you on the ground. This is just done on a table, so it's easier for you to get up and down, and it's better on us as the provider to not have to be hunched over and working on you. When we're trying to promote health, it's kind of hard for us to look like we're not promoting our own health. But that takes care of a bunch of the ones we talked about, right? We said there was 5 muscles that are involved. You get all 3 of the big groups of muscles just doing those 2 stretches there. And then there's a decompression stretch. Remember I said about the compression, right? Well, L5, the lowest disc in our spine right down here, accounts for 80% of lumbar surgeries. I think it's a pretty important one to stretch out. And this particular positioning takes the space between those discs that's like that and opens up that space by pulling over here. And that one will very much help with back pain or any kind of pain that goes down into a leg, like radiating pain or numbness or tingling. All right, so I'm gonna finish up real quick. Real important to understand that if you have fusion surgery or a hip replacement or a knee replacement, we have protocols for all of that. Stretch Zone was actually created for post-hip replacement and post-knee replacement. Because a lot of people would have it. If you did, you probably went through it, go through PT for a period of time, and they tell you you're done. You're not really done, but they tell you your insurance is done. So we'll see you later. And they usually give you a printout of stuff to do at home, and you probably don't do it. Human nature to not do it, especially if you start feeling better. But very important to create motion above and below a fusion. Like that disc is going to go next if nobody does anything, because these now all don't move. And you overcompensate above and below wherever a fusion exists. So I'll get into some of those at-home stretches. I'm telling you right now, they're not hard. The hardest thing you have against you is staying vigilant about being motivated. Because one of 2 things happens. You either do them and you don't like them because they make you feel sore and you quit. Or you do them and they make you feel better and you think you're done, so you quit. So if you learn anything, it's just be tenacious about, like, I'm gonna make a schedule for myself. I'm gonna put a reminder on my mirror in my bathroom that says stretch. Whatever it takes to just put it into your life. You don't have to do it every single day, but try to do it every day. And if you miss one day, it's no big deal. Just make sure you do it the next day. And if you miss that day, do it the next day. But the more often you stretch on your own, I promise you, the better you're going to be. So doing the hamstrings, you guys can come on up from there. Thank you, Deb, and I appreciate you volunteering. We'll get you perfectly straight when you come in. Hamstrings, if you're going to stretch on your own, please make sure you're on a floor that doesn't have like a slippery surface. Because if you were on a tile floor and had a chair like this and try to sit at the end of it, there's a high likelihood that the chair is going to go and you're going to fall down. So I like to tell people to get it against the doorway or against the wall so that it's not going to go anywhere when you try to do a stretch. But if you sit right at the edge of a chair so that your butt is the only thing on the chair and your hamstring's not on the chair, then when you take your leg out in front of you and straighten it, you'll probably feel the stretch right away if you're sitting in the right position without even bending forward. But if you want to make the stretch really good, bring your toe up so that your foot and your ankle are at 90 degrees. For some of you, you'll feel that stretch already. And then you're going to try to go down to a 3. Remember, starting with a 3, so that might only be the there. That's completely fine. You're not trying to impress anybody, right? And then a 5, and a 7. Now, I will say this about that. Some people are embarrassed to stretch when they're out in public because it maybe comes across as a sign of weakness to others. I don't know. I see it with a lot of athletes. They're like, I'm not going to stretch when I'm out at the tennis court. People will think I'm weird. That's not how it should be. People should be like, wow, he's stretching. He's really motivated. He's really proactive, right? So try to stretch when you're standing in line at a grocery store. If you're sitting at a Walmart, you don't have to do this one. But, you know, there's plenty of things you can do when you're just sitting in your car at a stoplight. Plenty of stretches you can do when you're at your house watching TV. But that hamstring is a really important one and a very easy one to do. The calf muscles. Very similar to what you did in that chair, right? But now you have something that you can wrap around your toes to pull your foot up towards your head. An exercise band is good, but be careful because they're usually elastic, and if it slides off, it's going to smack you in the face. So like a belt or a piece of rope or a bath towel works just fine. But you're trying to, you know, essentially feel like this is being pulled that way. Because now your whole hamstring's already at tension, right? And now your calf is at tension. And by doing that, you're going to stretch right there. And then piriformis, again, is the big sciatic nerve irritator. This is a really easy one to do. It looks confusing, so I try to just put pictures on there where it makes sense. But if you take one leg over the other one, and then for some of you, this might be the stretch. Sometimes just getting your leg in position is a stretch. But think of your knee wanting to go towards this shoulder. And then think about trying to pull it out a little bit, because if you're just going here, it's kind of like cranking right where your glute is. But if you can pull up and over, you'll feel right where your piriformis muscle goes. So think figure 4. And then just taking that leg that way. Very similarly, you can do this on your back on the floor to get the same muscle. She started with a figure 4, right? That leg would have been straight on the floor, right? It would have been a little 4 shape. And now you just pull that knee up towards your face, and you'll stretch right there. Pigeon pose is what if you're a yoga practice type person, very similar stretch to pigeon pose in yoga. Anybody feel like they couldn't do that one? That's pretty easy, it just looks a little confusing. There's plenty of videos out there on how to do these things. I just caution you not to try to do them like the person in the video does them, because usually it's not an inflexible person that has a video on the internet, right? Like they're 20-year-old yoga instructors who can do anything. You may not be able to do it the way they do it, but just get the idea from like the motion of what they're doing on how you could do it yourself. Again, I'm giving you these take home videos. This is one I would wait to do until you're pretty good at doing all the other stretches that are on here. And it's not a bouncing motion between, it's just showing, okay, you're in this position already, so you're there, getting the hamstring. Now you just take yourself forward and you're stretching the quad on the opposite side. And then vice versa, switch it up. The other hamstring and the opposite side quad. Understand something that maybe isn't inherently already understood. The hamstrings are in the front, the quads are in the, hamstrings are in the back. Just testing you. The quads are in the front. It's their balance that leads to pelvic tilt, that leads to forward posture. If one's tighter than the other, you're going to go in the direction that the tight one's pulling you. So if you have tight quads, you're going to go forward. If you have too tight hamstrings, you're going to go backward. Well, we already talked about nobody goes forward, right? Or excuse me, nobody. Thank God you're here. Everybody's going forward. So we know that these are already shortened, and we know that these are being lengthened all the time, trying to fight the fight to try to pull us this way. So spend way more time on stretching your quads if you really want your posture to improve. And then spend some time doing strengthening work on your posterior muscles if you want them to hold you in that position. Problem is, most people don't work out their posterior muscles because they're not vanity muscles. Nobody's like, look at my back. But they're all working on this stuff to try to be like Does that make sense? You know what I mean? When you see a bodybuilder, you don't like go, wow, look at their hamstrings. It's just not what we think about. And then this one's really good for the quad. If you step into a stairwell, I like the stairwell idea because there will be handrails usually that you can grab onto. So if you're doing this motion and you start toppling, you got something to hold on to. Again, always be safe rather than effective. I'd rather you not fall and get hurt than to have a flexible hamstring or quad. But all this one is doing is taking that posterior leg and trying to lean this way so that you're creating like a crescent shape, like a moon shape. You should feel that right in the front of your thigh, into your groin. The adductors are not always that important for our flexibility, but some people have tight adductors and it's hard for them to get into those positions to stretch the muscles on the outside of the hip. So if you do struggle with that, just essentially opening your legs as far as you can, in essence doing what a split position would try to do, but there's a lot better ways to do it than to try to do a split. So that's just doing a half split at a time, if you want to think of it in that regard. And then these ones that I throw at the end are ones you could do with the wall. It's really important, again, to have safety involved with all these stretches. So if you get your butt up against a wall, you're very much less likely to fall backwards when you're doing a stretch. And if you can control variables, at least you know the only place you could fall from that stretch is forward. This one's a little more advanced. This really does stretch out the fronts of your arms, but it's designed to arch your back and stretch in this position to try to get you back here. You're just doing it with a wall in the way to try to stretch this. Does that make sense? Think of your back hollowing out instead of rounding forward. You're doing the opposite and rounding back. And then the side stretch is really good for the lats. Again, if we just remember what we talked about, there's 5 muscles we talked about that were really low back related muscles. You can get all those with some simple stretches. I have to show you this because it's really true. There are muscles that we showed you can't stretch on your own, no matter what you try. We can, that's why we have the strapping. But notice that most of those are the muscles we talked about that were directly related to lower back and hip pain. One of the reasons I came out here, Thursday last week, to do a talk on neck and shoulder pain was because this talk is what I've done out here 25 times. It's the one that everybody needs help with. Neck and shoulder, we can help a lot with, but there's a lot you can do for your own neck and shoulder. There's not a lot you can do for your own low back and hip. I come out here and do a talk on pickleball, golf, and tennis. It's because it evolved from doing this low back workshop and people saying, that's why I have low back pain, but I also play pickleball and my shoulder is killing me. When you have a multiple hobby lifestyle, which a lot of you guys do, some of your hobbies are sitting around over a table, crafting and doing all kinds of games and stuff, and then a lot of your of your hobbies are walking and sports and working out. So you got a lot of different things that you could probably have addressed. All of this is really about the stretch reflex. You have a reflex in every single muscle, just like you have your patellar reflex. And it's a spinal reflex. So think about this for a minute. It does not even make it to your brain for your brain to make a conscious decision about it. It's a reflex that was set up inherently for us to avoid injury. If you put your finger on a hot stove, you don't sit there for a few minutes and contemplate, something smells. Wonder what I should do. Like, you immediately take your finger off, right? That's a spinal reflex. It goes to the spinal cord and back. Never even gets to the brain for any kind of conscious interpretation. Our muscles work the same way. So it's real important to understand that our muscles sometimes are going to be engaged and tight without us making any decision on it at all. That's why you can't think yourself flexible. You just can't. You have to get in there neurologically and change the stretch reflex so that it doesn't engage as fast the next time you put the same demand on a muscle. And that's what the 3, 5, and 7 do. They retrain your brain to say, 3 is where I thought I was stretching. Now I'm at a 5, and that's not that bad. Oh, I can handle that, and you've just gained 5 or 10 degrees. And then 7 is another 5 or 10 degrees. So by the time you're done one series of stretches, you could take yourself 20, 30 more degrees. If you did that all the time or did it repeatedly, you can build your flexibility and your range of motion. Again, practitioner-assisted just means we do it all for you. It's really kind of cool. We do have a lot of specific for conditions protocols. So if you're like, man, I got sciatica that's killing me, we got a protocol for the right muscles to do for that. It's like a combination lock. If you're like, man, my shoulder kills me and I had a rotator cuff tear, we have a whole set of stretches specific to that. And we are board certified, which is kind of cool. We let you guys choose what you do in our office. You decide how often you come. We'll coach you in the right direction, and if you ask questions, we'll tell you what we think you need. But at the end of the day, you choose how often you go to us. And if it works, it works. If it doesn't, then you have to reconsider, did I pick the right frequency of coming there? Sometimes it's just that we're not seeing you often enough to fix what you got. Sometimes we're seeing you too often and you're getting better quick, and it makes sense to change what we're doing. Anybody heard of Wilmington? So I counted, we've got 68 people from Brunswick Forest that come to either of our 2 studios now, which is kind of cool because I started my first talk out here in January. Today is my 12th talk out here. I say that because I know it's over the bridge. And I know that's a whole nother country to most people, but we are anticipating hopefully opening a location in Leland in 2025, but it's not on the books yet. So don't hold your breath. It may happen, it may not. But we do have 2 locations in Wilmington that you can come in. The demo is free to come in. Some of you have already been in. The demo is where I get to see what you got. Like I check your range of motion. I check every muscle. I want to know what you have that should be worked on, and I want to know what you have that can't be worked on, so that I can put a proper note together for any of the practitioners to know what they can and can't do with you. But the demo is free. So you get a full half-hour stretch. And then one thing I do for you guys for Brunswick is, this is only for Brunswick Forest, that's why I asked if anybody was here that was not from Brunswick Forest. I let you guys come in and do 2 half-hour stretches. Because I feel like if I'm gonna talk about whole body flexibility and all I can do in a half hour is either the lower body or the upper body, I give you guys a chance to do both so that you can see what we can do for your whole body. I do know this, I only have, I think like 2 places this week available. We're kind of busy. And then next week we've got a handful, and the week after that we have a lot. So if you want to do 2 for free, you got to let us know today, because that's part of the deal. Is like, if you're motivated to be in there, we'll give you 2 for free. You can always come in and do the demo for free on your own. There's just not the second one for free.